transferrin, and also ferritin. These are all the markers to understand your overall body health and also the strength of your hemoglobin, because the hemoglobin is very important to bind with oxygen to send oxyhemoglobin to other parts of the body and release the carbon dioxide. And fructosamine is a very useful in monitoring the degree of kind of a glycemia, like how exactly the metabolism of sugar levels are going on, and short to intermediate time frames. Concentration greater than the established normal range is something very important to understand the hyperglycemia. Hyper means high level of sugar levels in the body. So the higher fructosamine value, poor is the degree of glycemic control. So you need to understand this marker. Fructosamine is very important to maintain the level of and blood ketone is a very interesting marker. I think Iris love this marker because people who go for especially fasting, right? This is something very interesting marker. Ketones are a type of chemicals that your liver produces when it breaks down the fats. So your body uses ketone for energy, typically during fasting and long periods of exercise as well, or when you don't have as many carbohydrates. So the ketones can be used. So you can have a low levels of ketones in your blood without it being a problem. It's an interesting marker to understand different levels of your fasting nature and also to maintain the energy levels. Lipoprotein, LPA, is another interesting marker to understand coronary heart disease or any kind of existing disorders. Very interestingly, the serum copper, another important marker to understand the functions of different enzymes in your body and also the formation of connective tissue and melanin synthesis, iron metabolism, development of central nervous system markers, and angiogenesis means the cardiac cells, exactly how they form the vessels and blood vessels and arteries and veins, or when there is a kind of a blockage, how the angiogenesis can be promoted by nature, not by inducing by chemicals or giving some pharmaceutical drugs. It's a very interesting marker to understand. And also testosterone is a marker to understand the along with the luteinizing hormone. It's helping him to evaluate the hypogonadal males. For example, problem in secreting a proper sperm levels and all that. So major causes of lower testosterone in males include hypogonadotrophic metabolism and testicular failure and also hyperprolactinemia. So these are the disorders. Amylase is a very interesting marker in the oral secretions in saliva, and it also one of the interesting marker for digestion and also promoting the avoiding metabolic problems in the digestive tract and all that. And lipase is another interesting marker to understand. It should be in conjunction with the medical history. So the higher serum lipase is a specific marker for pancreatitis, inflammation of the pancreas, and thereby people tend to get other problems in secreting insulin. And also after acute pancreatitis, the lipase activity increases within 4 to 5 hours and reaches a peak within 24 hours. So however, there is no correlation between the lipase activity determined in serum and the extent of damage to pancreas. So this could be assessed by along with other markers, probably other diabetic markers like level of insulin, functions of islets of Langerhans, and also by monitoring the HbA1c. So that might give you a battery of a connectivity for understanding the level of disease. And talking about interesting hormones, interesting factors, like for example, cholesterol, total cholesterol, HDL, LDL, and triglycerides. As you could see in this picture here, 93 is a value this person got, 93 milligram per deciliter. So anything less than 150 is normal. So it's more indicative that this particular patient or this particular person is not having any problem in triglycerides, which is a crucial marker. It's the presence of like oil in the blood. Sorry. So when a person got more oil in the blood, more like a fats, lipids, high cholesterols. So this is the very interesting marker to understand whether the person is having a risk of cardiovascular problems. And the other markers like alkaline phosphatase, bilirubin is like a marker for liver. Bilirubin, gamma glutamyl transferase, GGT, and SGPT, SGOT. So these are all markers for liver profile. For the liver profile to understand, and also when the liver becomes a fatty liver, it has been reported that almost 7 to 15% of the Asians do have the fatty liver. Fatty liver normally does not cause any kind of a fatal disorder, but it might cause other metabolic problems, and also the functions of the liver will be interfered. So alkaline phosphatase is one of the indicative marker for fatty liver. So when there is a fatty liver, people can experience the high levels of alkaline phosphatase. Say, for example, here, 45 to 129 units per liter is normal. So probably when a person got a problem in a liver damage or problem in fatty liver, they may have more than 129. So that is an indicative marker for these problems. So VDRL is for syphilis, is a venereal disease research laboratory test to understand whether the person got any kind of a gonorrheal infection or a syphilis, STD, sexually transmitted diseases. And magnesium, as we all know, that is one of the most important molecule. Magnesium is the fourth most abundant cation in the body and second most prevalent intracellular cations. So the disorders of magnesium metabolism are separated into those causing hypomagnesemia. And also magnesium plays a very good role in maintaining the functions of gastrointestinal problems and also the function of kidneys. It also helps in the DNA synthesis by making the DNA replicase enzyme to act perfectly. So when there is a lack of magnesium, it might even avoid you to get a proper DNA synthesis, and thereby your cell damage, and then it becomes atrophic, and then cell death, and also human death. So there are a lot of sequences of what you call the post-magnesium disorders. Phosphorus is another interesting marker. In plasma and serum, the majority of the phosphate exists in the form of inorganic form. It's called inorganic phosphate. It's called PI. Approximately 15% of the bound to protein, and the remainder are complex in the free forms. So serum phosphate concentrations are dependent on the diet and also the variation in the secretion of hormones such as parathyroid hormone. So when people have some kind of a kidney profile or kidney problems and all, we always tell them to reduce the levels of what you call phosphorus intake. Potassium also very important marker for kidney profile, and like hyperkalemia or potassium increased levels can be found in any kind of what you call a kidney failure people. So we need to reduce the kidney profile in order to reduce the potassium levels. The adults, the range could be less than 5.1 is normal. So this particular patient got 4.46, which is normal again. For this particular analysis of this test, right, I'm using the actual laboratory report of a person to whom I already got the approval from him. So it is a real time laboratory report. That's why I'm showing you here the real copy of it. And talking about other markers like blood urea, nitrogen, creatinine, very interesting marker for kidney profile. And urea calculated, calcium, uric acid, sodium, all these are fantastic marker for understanding the functions of your kidneys. And it's very, very interesting to understand. And urinary range, also we call BUN, is very interesting marker to note the functions of creatinine and also the urine analysis. Total trideoxythyroxine and also total thyroxine is like we call T3 and T4. So the results should always be linked with other particular functions of thyroid gland, so that this could be one of the interesting marker to understand the functions of your thyroid hormones. and how exactly they will help in regulating your total levels. Next one is a EGFR. It's a very interesting marker to note the functions of your kidney, especially the glomeruli, the coils of the kidneys. The coils present in the bean-shaped kidney is called glomeruli. So how exactly your glomeruli has been doing a filtration, what we call glomerular filtration rate, GGFR, estimated glomerular filtration rate. So this is something, the quite normal range could be around more than 90 milliliter per minute in 1.73 meter square of your glomeruli. So anything less than that, could be due to, for example, 60 to 89 is a mild disease, and 45 to 59 is a mild to moderate disease, and 30 to 44 is moderate to severe, and 15 to 29 is a severe disease. So this will make the medical doctors and nephrologist or kidney specialist to understand whether to recommend the patient for dialysis or not, especially when they go below 15, 15 milliliter per minute per 1.73 square meter. That means to say that the patient's kidney has been failing. So it's a fantastic marker to understand how to monitor the function of kidney. So you can do this lab test for a few times, maybe like once in 2 weeks, like that, then try to confirm. So this is one of the very, very descriptive and interesting and related marker for medical doctors to interpret, so that they can understand from this whether we can recommend make them to go for a kidney dialysis or not. It's a very interesting marker. Fasting sugar, again, you go for fasting maybe like from 8 p.m. from the previous night, and tomorrow morning like 7 a.m. And now, as you could see here, it's like 138.36. This particular patient got 138.36 milligram per deciliter. It's now why I took this as a very interesting, because now they say that, see, if you are 126 milligram per deciliter or higher, now they say it's diabetic. But last time it's 140 and above is 140 and above maybe pre-diabetic, and 160 and above is diabetic. Now this current lab report is the real lab report, okay, from one of the laboratory. Now they say that, so all the laboratories have been instructed that anything 126 and above will be higher, which is the patient is entering into a diabetic condition. But personally, I don't agree on this. I mean, I don't want any argument on this, but I'm just suggesting you that still 140 and above may be diabetic. So this particular assay could be affected mildly or may result in the other markers. So you need to really understand, whether you are, as I say, pre-diabetes is 100 to 125, So this is something we need to really be mindful about it. And diabetes, the screening, we need to do urinary microalbumin. It's a very interesting marker, and creatinine also very interesting for understanding, relating the diabetes and also with the renal profile, and albumin. And also albumin and creatinine ratio is to understand the proper functioning of your kidneys. And this is a urinogram. It's like, the dipstick test that is also more indicative and also tell you whether you are having any diabetes or any crystals or any salts and deposits, as you could see here, the CAS crystals, bacteria, or any infection, microalbumin. This one dip test can relate you with all kind of many markers. More than 15 different markers can be understood from this. And Epstein-Barr virus also can cause inflammation, and Burkitt lymphoma, is one of the disease common in African countries, and now getting common in Asian countries as well. Is also a marker. We have the Epstein-Barr virus capsid antigen marker to understand the value. So 6.7 for this particular case. So anything 1.2 is positive. So this particular patient may have been earlier been exposed to Epstein-Barr virus, but not getting any kind of infection or disease. So he might have got the antibodies now, IgG antibodies. So we don't know whether this is the preventive marker or this could be a marker to understand whether the patient got exposed to the virus or not. So it's more on the decisive nature of the doctors. And we try to see some of the cancer markers now, like CA125 is a very interesting marker for ovarian cancer. Can also be linked with the other cancer markers as well. It's an ovarian marker. They do CA125 by using, can be photometry. It can also be done by using DNA analysis as well, by PCR, polymerase chain reaction. And CA19.9, also they can do by photometry, CLIA technique, or they can also use by PCR, polymerase chain reaction, using the amplifying the genetic marker by using a specific primer that could amplify the genome which is related to CA19.9. That could be related more to lung cancer, gallbladder, gallstones, pancreatitis, cystic fibrosis, liver disease, and also pancreatic cancer. So many kind of, it could be indicative. Not necessarily one has to have any one of these cancers, but it's indicative, meaning to say that they have a risk of going into this kind of a problems. So it's an indicative marker. But those who got it, any cancer, and go for 19.9 CA marker, you can use this as a kind of a marker to understand whether you are trying to recover from this by understanding the reduced levels of this particular CA 19.9 marker. So adults can have up to 37 units. Let's say for the cancer, it must be less than 37. So let's say someone got about 60 units. That means it can be any one of these cancers, right? So, but somebody got, let's say, pancreatic cancer, very difficult to cure these days, and that could be an indicative marker, 19.9. So, by giving some kind of a treatment levels, or some kind of a treatment regimen, or this particular patient choose to take some supplements, and after a couple of months, a couple of weeks, right, you can do monitor by checking this 19.9 marker to understand whether the patient has been recovering or not. So in a way, all these markers are helpful in understanding whether the patient has been fully recovering or not. Alpha fetoprotein is a very interesting marker for cancer marker. AFP testing is being done during pregnancy in combination with the beta HCG hormone, and also E3 is recommended as an effective way to determine potential fetal risk of open neural tube defect, alpha fetoprotein. Carcinoembryonic antigen, CEA, is a very interesting marker to understand the patients with the cancers, and also monitoring the cancers in gastrointestinal tract. And also the increased CEA levels can indicate some non-cancer related conditions such as inflammation, cirrhosis, peptic ulcers. It could be a chronic ulcer disease. And also smokers tend to have the higher CEA levels than non-smokers. So you need to interpret in a proper way. Anti-hepatitis A virus, which is like one of the indication that the patient, the particular individual got antibody to the HAV, because HAV mostly go by fecal oral route by water contamination, and high sensitivity troponins. High sensitivity troponins. Troponin assay can be used as a marker to understand the risk stratification and also identification of the patients with the suspected acute coronary syndrome. Troponin markers. So it really helps in any kind of a myocardial injuries, any kind of a trauma or shock to the myocardial region and heart as well. Anti-hepatitis C virus, which is a dangerous virus, can go by both fecal oral route and also by blood route. So you need to really understand whether anybody got a symptoms of jaundice or liver problems, which can be associated with hepatitis C virus as well. So these markers can be very helpful. Surface antigen marker for B virus is also an interesting marker to understand whether the patient got any liver disease or jaundice or liver cirrhosis or liver failure. So inflammation biomarkers across the range of human disease also can be helpful in understanding. And these are the markers like inflammation, like CK, MB, troponins, myoglobin. And serial sampling is very important to understand the disease problems, possible cause of elevations of cardiac troponin. So you need to be really understand and ask these questions to patients whether they have exposed to these problems. And clinical history should be combined with the other lab reports like troponin and ECG. Then you can decide whether the patient got any kind of a myocardial injury and all that. Clinical history is very important to link with the laboratory reports. And the troponin levels, as I told, right, it's not early biomarker for of necrosis, increased diagnostic sensitivity and specificity, and increase in concentration has been prolonged to get myocardial injuries and all that. So the different modalities of aging process also very important. DNA damage, shortening of the telomere, gene expression has been mutation, protein becomes less functional, cells don't die when they are supposed to die. For example, the senescence, the dead cells must be removed from the body, otherwise it becomes inflammation and toxicity to you. So imbalanced metabolism, stem cell exhaustion. So a lot of things can cause the aging process. And also, as I told earlier, magnesium is an important molecule for making the DNA polymerase to replicate further to make more DNA synthesis. So aging process is like a delay in upstream effects of aging, and the process of aging can cause inflammation and oxidative stress, mitochondrial problems. Mitochondria is the powerhouse of the cell, and thereby, if the mitochondria has been under stress, then cells will be more going to senescence. And that might even cause the patient to go for age-related disorders like Alzheimer's, diabetes, cancer, disability, CVD, cardiovascular problems, Parkinson's, osteoporosis. And if we don't revert it, and if we don't treat on time here, or if we don't understand the disease pattern, then, or if we don't go for a specific treatment, then the mortality will be very high. So the current challenges like aging process, inflammation, lack of gut immunity, epigenetic factors like your style of food intake and nutraceutical intake, and then your other drugs and medications can affect the genetic status of the human body. And taking the statins, the cholesterol lowering drugs, and also NSAIDs like non-steroidal anti-inflammatory drugs, abnormal consumption of antibiotics and other pills. And for some people, like mental health issues like family isolation, social isolation, depression, anxiety. So these are the total challenges for, aging problems. And 7 ways you might be harming your immune system as well: by unhealthy diet, lack of sleep, consumption of alcohol, smoking, dehydration, and lack of exercise, stress and anxiety. Vitamin D deficiency, as I told earlier, vitamin D is a major important molecule and also important marker to understand osteoporosis, any kind of a bone mineral density disorder. It can also be linked with the cardiovascular problems and also the liver damage. So multiple functions can be monitored by the levels of vitamin D. So one has to have the adequate levels of vitamin D. And sometimes you also harm your microbiome in the tummy, which is the collective microbiome. And you need to really avoid making a reservoir of the harmful bacteria in the stomach. You only need to have the harmless and also the probiotic bacteria in the stomach. So there are some remedies for healthier gut immunity, like probiotics, and it can also help with the other group of prebiotics as well, which can form the food for the probiotic bacteria, like mostly the lactobacillus, bifidobacterium. So these are the fantastic probiotic bacteria, and we have a lot of prebiotic and probiotic substances to understand the mechanism and also to avoid the challenge from the Helicobacter pylori. So my dear friends, this is one of the great challenge for your tummy, causes the ulcer. And if you don't treat on time, become chronic ulcer. and also gastric ulcer. And if you don't treat gastric ulcer, it might become gastric cancer. So it could be linked with even gastric cancer. It's not the direct cause of gastric cancer, but it's one of the factors to induce the gastric cancer. That has been confirmed. And there are several symptoms can be experienced by H. pylori, starting from IBD, bloating, and you can test by using a simple breath test. No need to go for invasive thing, or you can take a sample of blood to check antibody to H. pylori to understand whether you are exposed to this bacteria or not. So how deadly is H. pylori? Can cause several type of ulcers, scleroderma, urticaria, lymphoma. So it can cause starting from gastritis, like a simple ulcer, and move on to chronic ulcer. Other part of it cause the gastric ulcer or duodenal ulcer. The gastric ulcer can become gastric cancer. A duodenal ulcer can become chronic ulcer. So the H. pylori can cross the mucous layer of the stomach by drilling. It's like it's called helicobacter because it's a helical shape. It's like a corkscrew shape. Can drill and bore and go inside the intestine, in the stomach, have the nutrients from there, and then come back to the other side. Because at the low pH, right, it's very difficult for this bacteria to live there. But it contains enzyme called urease. And this urease enzyme helps the bacteria to convert into all the food into related factors for the bacteria. So it's very interesting to note. So other infections and molecular markers like hepatitis B virus markers, cytomegalovirus markers to relate with any kind of a cardiac problems, and markers for HPV, human papilloma virus, HIV, and herpes simplex virus marker, Japanese encephalitis virus markers to understand any kind of mental problems, and also the so-called brain fever and brain tumor, and step pneumonia and step pyogenesis to understand any kind of the shock or septic shock or septic shock syndrome in the blood circulation. And also it might make the person to have the lack of oxygen supply to the blood, and also oxygen supply to the brain, and that become brain death. So, and it also causes the so-called what you called muscle eating, or the tissue eating, or a flesh eating bacteria, step pyogenesis. So what happened is it might cause a lot of what you call pyogenesis. So lack of muscles, in the lack of tissues, lack of flesh in the system. So you can only see the bones. How crucial it is. So we need to really understand by having early markers for this bacteria to know better about this. So what are the remedies for understanding? We know now different biomarkers, and we know now that how the many diseases can be caused, how we can interpret, and overall we can throw some information, like when you go for some supplements and all that, you need to really focus on avoiding the spike molecules. And the common side effects of these spike molecules, right, feeling weak and tired, infections, abnormal heart function, drooling, stuffy nose, and many other things like vomiting, diarrhea, headache, flushing, persistent cough, hallucinations, paranoia, means you don't even trust anybody, psychological depression, anxiety, and panic disorders. So there's a spike molecules, tag molecules can cause all these issues. So there's a need for a relevant supplement. So nature has given, like curcumin has been proven to be fantastic, anti-inflammatory, antiviral, and can prevent several kind of bloating disorders. And therapeutic effects of resveratrol can help in many type of human and animal diseases, and also can help in the cell toxicity to reduce, and also to help functioning the proper kidney functions, and multiple organ functions can be regulated by resveratrol. And quercetin is another interesting marker to avoid making people getting from kidney injuries, and any other kind of pharmacological molecular docking study has been proven that resveratrol and quercetin can help in even lowering the damage caused by COVID-19, and also the acute kidney failure as well. So these are the natural compounds. So what we have done in the D ways is we have included most of these natural compounds in HL span, almost like 23 different ingredients to boost up the basic immunity of your body, and also to have the what they call mitochondrial biogenesis, and also to lengthen the telomeres. Telomere is the edges of the chromosomes. That could be a predictive marker for understanding how older you are, in fact, of your age by biological aging process. But what happened is, physiologically, anatomically, are you all right, or are you having any kind of what do you call the health issues? So we normally divide them into two different pattern, my dear friends. Number one is called health span. Number two is called lifespan. So lifespan is the overall health. Let's say a person can live for 90 years, for example. That is his lifespan. Health span means during this 90 years, right, how healthy you are. Let's say a person is very healthy until the age of 70, and after that he's experiencing some neurodegenerative problems, maybe Parkinson's and all that, bedridden. So his health span is only 70 years, but his lifespan is 90 years. So my dear friends, please note down, from the age 70 until 90, this particular patient will still be alive, but he will be wheelchair bound or bedridden. We don't want to be a burden to anybody, but our loving children, in fact, they want to take care of us. But the problem is, when you become a burden to the family, right, it really damages their career also. Most of the children in these modern days don't think that they don't want to wash their hands and get away from you. In fact, they really love you. They want to take care of you. But what happens is, you become a burden to their career. Let's say they have their children. They need to really build up their family. So especially places like Singapore, healthcare becomes more and more expensive these days. And when you are bedridden for, let's say, 20 years, that's why I'm telling you now the lifespan and the health span. So you need to really improve the health span as much as possible, and you don't have to be dependent on anybody. You will be a self-dependent individual, most courageous individual. So you need to really have that kind of a nature of living by having suitable supplements. And also, you can choose your own natural pathway, my dear friends. So to lengthen your health span, you can increase the lifespan, also increase the health span. So when your health span is reduced, right, then you become a vegetable. You become like a burden to the family. You are good for nothing. And nobody can kill you also. Mercy killing or other things are not permitted. So they really need to take care of you. And where are you going to live? So we are going to put you in a hospital, a nursing home, or any kind of hospices. Hospice is meant for terminal ill people. Anytime they will die, migrate to other part of the world. So we need to really take care of your fundamental health. But we are telling you by natural way. Avoid taking a kind of pharmaceuticals. Try to reduce it. Don't take so much of chemicals and preservatives in our food. But anything you buy, it has got a preservative. You buy a simple chips and eat the chips to give the crunchiness, right? You have a preservative there. That could cause even the cell to damage. Let's say few cells in the liver damage, right? Not everybody will get liver cancer. But let's say 1,000 people eating the chips, then some people, the chemical in the chips can cause them to have 10 people get the change in the cell nature. Out of the 10 people, one person can become liver cancer. So for every 1,000, one become liver cancer. You can extrapolate to the rest of the world. We have 8 billion population. So every every nutraceutical is going to help you to avoid all these things because it comes from the nature. So you need to really think about taking the preservative food. I'm not talking about the food which is poisonous. Even you buy a chicken, frozen chicken, the chicken is not poisonous. It's a fantastic one. But I'm now trying to alarm you, the chemicals they use to preserve the chicken is the killer. Please note that point. Anything which is very tasty, you buy some something for munching, how do you get that the kind of a crispiness? It's due to chemical. I don't talk about the ingredients they use. The ingredients are fantastic. They will never harm you. It can be a rice flour, some sugar, some wheat flour and all that. But to lengthen the life of this product, right, they add a preservative. So my dear friends, I'm alarming you that preservative may be a killer. That's why try to go with the nature. You know, for example, chicken, you can go and get a compound chicken to have. So, I mean, I'm maybe joking, but it's possible, right? So try to be as close to us nature, because we are living in Singapore. We are getting all kind of food product from other countries, right? So we can't expect everything to be 100% natural, right? But what I'm trying to say is try to minimize the preserved food, especially the chemicals they use for preservative. So in nature, we have this HL span, which is fantastic for preventing different types of cancer, antibacterial, antifungal, and make you to adapt to different stress levels and so on. And also lengthen the telomere so that it can reverse your aging process, my dear friends. So the telomere, which I told you, is the edges of the chromosome, can determine your age factor, your healthy age factor. Because of various stress, anxiety, depression, chemicals, the telomere length is going down and down. It's something like a beads in the string. So from 12,000 units, you got only now 2,000 units. Everything spent already, depreciated. What happened? You tend to become older. You tend to get dementia, Alzheimer's, Parkinson's, and many cardiovascular problems. So now we have a solution here. We try to lengthen the telomere by adding the units. The beads on the string will be added by this HL span product. Thereby, your telomeric length will be increased from 2,000 to 12,000. And thereby, that will open up your communicative network in the body, and from brain to the brain connection to other network, and from other network to the brain, it become reverted. That's what we call reversal of aging. It's not by beauty. You know, I don't want Dhamo, don't look like a British man. No, I look like myself, but I may look healthier after that. So even at the age of 90, where you are supposed to get some kind of neurodegenerative problems, that will prevent you, or that will avoid you getting it into the club, so that you can lengthen the health span. Your lifespan is already God or nature determined. You believe in God or you believe in nature, whatever. That determines your lifespan. But I am helping you to understand the health span. So you have the 90 years of a lifespan. I pray that you must have 90 years of a health span. So you are a disease-free person. You can do anything as you like, even at the age of 90, then can leave the other part of the world peacefully. You know, that's my suggestion, my dear friends. So we have yet another product coming from nature, all from the plant sources, as you could see here. H-Stasis is another interesting product with the multivitamins and minerals, help you to boost up immunity and so become a good antioxidant. And Purify is, as I told, fantastic product to give you the probiotics, all the 5 different bacteria, which is like a probiotic bacteria, because now we have when you have the healthier tummy, right? When your tummy is healthier, and your entire life will be healthier. Your every day will be healthier. Imagine you have a bloating tummy, IBD, IBS, and then a gaseous. You don't feel healthy. You can't do any, you cannot perform any work more actively and happily and successfully. So your health is very important by determining the status of your stomach. So please make the bacteria, the probiotic bacteria, to live in there and prevent the all harmful bacteria which has already been inside your body. Eliminate them by introducing this new lactobacillus and then bifidobacterium gezzeri and all that. So this is the fantastic product which comes in like a sachet. And we have both pre and probiotic in one blend here. This is one of the very unique product in the market. The probiotic is a bacteria and the prebiotic is a food for those probiotic bacteria, so that when they go inside, they can multiply, establish, and then become symbiotic with you. Symbiotic means give and take policy. I help you. So that means you are helping them by providing a shelter. They help you by synthesizing different types of vitamin K and make your body more stable and make you happy by defining unhealthy molecules to remove from the body, eliminating, excreting, remove all kind of toxic heavy metals from the body. They can do all the wonderful jobs. So that's how these purify can help. So probiotics, in fact, they're very good for people with the lactose tolerance, help in hormonal balancing like a puberty and monthly cycle for women and menopause symptoms. When you want to have a peaceful and pleasant and happy menopausal transition of the 2 years, right? Here is a solution. Please have a very good gut immunity and gut system so that you can have a very happy menopausal transition. You don't have the kind of anxiety, angry, throw things on other people, depression, and get what you call mood swinging and all that. You can prevent all that from having this purified product. B-Glow is yet another product to remove all kind of heavy metal toxicity and also to maintain the collagen production in the skin. You don't have to go by get the collagen from the fish. We have here from the nature. All the B-Waste products are coming from nature. It comes from the vegetarian products. So it's very suitable for vegans and vegetarians as well. There is no animal product involved. CNRG is an energy source for day-to-day life. It helps in avoiding inflammation of your body and remove any kind of heavy metals and keeping you all the time active by housekeeping, by giving you the vitamin C complex. Uplift is a very good hormonal product. The name of Uplift, it uplifts your hormonal balancing for both men and women, and it helps in natural testosterone production for men with erectile dysfunction. Also it helps, and for women with the mood swinging, menopausal problems, menstrual cycle problems, it really helps. And even for women with the high secretion of estrogen, right, this will regulate the estrogen secretion as well. So it helps in multiple ways. And omega-3 plus other 6 nutraceuticals like astaxanthin, vitamin D and E, grapeseed extract, hydroxytyrosol, fucoidan. Fucoidan is a very good for anti-aging, like what we saw before in our HL span. So it's a very good for people who are undergoing neurodegenerative problems. Like it will prevent you getting into dementia, Alzheimer's and Parkinson's. It comes from the seaweed. Normally people take it from the shark because it takes from the small fish. They take food from the small plankton, and plankton get it from the seaweed. So basically the shark is getting the omega-3 from the seaweed. But we have gone to the nature, extract the seaweed, and then purify and also extract the procedure, get the omega-3 from the plant. So that's why it's all suitable for vegetarians and vegans as well. So it's a very good for people with it can help people entering into dementia and other problems as well. So overall, my dear friends, the biomarkers are very useful in determining different types of disease pattern, understanding the different types of health pattern, and how we can predict different disease by understanding a simple marker. And my good suggestion is it also helps in eliminating going through the invasive procedure, surgical procedure, invasive procedure for taking a sample for lab test. And you don't have to go for a CT scan, MRI and all that. When you have a proper blood test, and also when you have a fantastic doctor who can interpret very well, and many a times, I'm not telling all the time, and many a times you can prevent or avoid going for radiation by exposing radiation through CT scan and MRI, also minimum radiation, but fine. But still you can, cost effectiveness is there. So you can go into biomarker testing. And also when you have any kind of a lifespan or health span problems, you can always get into the products which I explained just now. And in D-Ways, we are also available every Saturday for a discussion from morning 10 a.m. to 2 p.m. You can have one-to-one session with me also. And Iris also is giving all the time several kind of health talks and all kind of marketing strategies and all. So thank you so much for your kind attention for this talk. And I'm so happy to share any questions. Thank you so much.
Thank you so much, Dr. Dhamo, for the very informative talk this evening. If you can stay around, there are some questions for you. So we have a question from Noor. She says, before taking dose marker test, should one fast in the evening before the test being done in the morning?
Is it talking about diabetes, right?
Noor, can you please, if you can unmute yourself or clarify? I believe different markers have different requirements. Some
It depends on different marker. So the timing is also very important. I really appreciate that. And especially, for example, let's say to make you understand, for example, for diabetes, right? So it's better to go for a fasting sugar, meaning to say a fasting sugar test means previous day night from 8 p.m. you're not supposed to eat anything. So you can have a cup of water in case you feel thirsty. You can have a few cups of water in the night, and tomorrow morning, let's say 7:30 or 8 or 8:30, must go for a blood test. That's what we call fasting sugar test, where we do the HbA1c. And there's one more thing, right? For example, if you really want to do the extended test after the morning breakfast, after before the breakfast, the fasting has been done. Then you can go for a breakfast, and 2 hours later, you can do one more laboratory test for the HbA1c also, or any kind of a sugar test also, to understand the level of diabetes. One more thing is, if you don't want to do all this, you can also do a test called glucose tolerance test. The one is they let you drink glucose water and then see how exactly you are metabolizing it every hourly. Starting from 8 a.m. you drink, and then 9, 10, 11, 12. So 4 times they take your samples to test and then let you understand whether you have any diabetes or not.
Okay, thank you. Okay, so there's another question. It says, if anyone is diagnosed for cancer or tumor by doctor, should he or she go for second opinion?
Yeah, in fact, the suggestion is now that we have, since you didn't mention the specific cancer, it can be a breast cancer, a liver cancer, or any type of cancer. But now we have multiple markers for many types of cancers, like PCR test available, and we have different photometric tests available for various cancer markers. So you can pick and choose, or if it is an overall health, right? Say, for example, you are a very normal person. Once in 2 years, I always recommend people, once in 2 years, you go for a general health checkup, doing all kind of a cancer marker tests. So it could be indicative that whether you are entering into any type of cancer by determining a mutation or any change in the genetic pattern. Yeah, thanks.
Okay, thank you. All right. Somebody says how to reduce hyperthyroidism symptoms.
Yeah, actually, we have a battery of marker for thyroid markers. So the first one is number one, you need to really understand before we go for the thyroid marker test, right? It's better to do various minerals and various chemicals of your body, starting from potassium, phosphorus, serum creatinine. You can do a kidney profile and liver profile, and you try to link that with your thyroid profile by doing a T3 and T4 thyroid test. So liver and kidney profile plus T3 and T4 will give you a complete index of how exactly you are going through the thyroid process. And then my suggestion to those who got the symptoms or the laboratory test positive for thyroid, right? You can go ahead with your own drug, but our suggestion is we have a solution here with the HL span and combined with the our omega-3 and H-tasis can really help to bring down the hyperthyroidism.
Yes, the best example actually, my hyperthyroidism is actually no more already.
Yeah, Iris is a living example.
So you can talk to the person that recommended you today for more information. Okay. So okay, somebody asking, I would like to ask if there's any test I could do if I'm having post-COVID symptoms since October 2022.
Yeah. So for example, if you got a vaccine or if you don't get vaccine or you got exposed to COVID-19, now the best thing to do is you can do antibody test for, we have done so far antigen test, right? My suggestion is to go for COVID-19 antibody test to understand whether you're fully recovered from the infection or not. To understand whether what we call, when you have the COVID-19 antibody positive, right, which is indication that you got exposed to the virus, maybe or may not be you have the disease. Some people will have silent disease, right? Some people expose symptoms like rhinitis, cough, they lack of smelling, they reduce complete smelling and all that. But with that, right, when you have antibody positive, that means that it's indicative that you are recovered completely and you are now immune to the virus. Probably when the new type comes, right, again, it will be challenging you. That is the main problem with the COVID-19. Yeah.
Okay, yes. So yes, Kenneth, you can talk to me later, okay? Next, heartbeat more than 100, frequent perspiration and limbs trembling. Yes, so the person says, I guess she's asking what can she do? When she got a heartbeat more than 100, frequent perspiration and the limbs are...
Oh, okay, okay. So probably you must assess the first thing you need to do is you must understand any family history first, you know, because most of the time these palpitation errors are associated with the family history, number one. And if you don't have a family history and you develop it, right, and you need to understand, is it like work-related stress or any kind of a depression or anxiety, or you must also really go and watch the type of food you're taking. There are many type of food, right? Like the fried items, deep fried items, but deep fried and frozen, again, fried items can induce the high palpitations. So you need to really watch your dieting and family history and see whether you can reduce this or not. And solution here for our HL span really can help on regulating the palpitation as well. So you can try our product also, which is a fantastic and more relevant to this bringing down the rhythm, you know, the cardiac rhythm as well. Yeah, thank you.
Yes, I have a lot of testimonial, positive one. The heart palpitation all resolved like in a very short time.
Yeah.
Okay, so the person who brought you. Okay, next, Harris is asking any advice to treat or reduce autoimmune disorders, for example, myasthenia gravis, SLE, and rheumatoid.
Okay, I understand the question. You're talking about SLE means systemic lupus erythematosus and a few other what you call the skin and other internal related problems like rheumatic and all that. So the number one is, as I told, right, please go ahead and check the alpha fetoprotein and CRP, you know, C-reactive protein, carcinoembryonic antigen, homocysteine, and troponin. So these are the first few markers I explained, more related to all these disorders you mentioned. And after once you confirm that these markers are in the higher level, you can try with our products, you know, HL span with the combination of the three more products. So HL span, you can combine that with the omega-3, H-stasis and purify together can really help to regulate these problems. And since you mentioned about SLE, I also suggest to take B-Glow as well. So totally it will be a 5-product combination, can help you to fight against whatever the multiple problems you just now mentioned. Yeah, thanks.
Thank you. Okay, somebody's asking what products to take for early stage Parkinson.
Oh, fantastic. Okay, when you talk about early stage Parkinson, right, we need to really understand why people get Parkinson's. So number one is the Parkinson's, you tend to lose the motor functions. So the brain and the motor neuron connections will be lost. But why do you lose this? Is because there is a lack of the neuronal cells which control the motor functions. So once most of the brain cells which controls the motor function start dying, right, there is no way you can bring them back. For example, if the liver cell dying, they will come back. If the skin cells are dying, the skin cells will come back again, rejuvenate, will grow again. Whereas the neuronal cells, the current research studies, although they are trying to replace or trying to make them to regrow, is so far not so much successful. So my dear friends, now the answer is, you need to really, we can't make the brain cells to come back to the normal number, but we can prevent it, the brain cells dying faster due to the shock, due to depression, you know, other products like, you know, smoking, alcohol consumption, many things. So now the solution here is that we have fantastic solution through omega-3. Omega-3 is a C-Wise, you know, the product called C-Wise, which is helpful in reducing the neurodegenerative disorders like Parkinson's. So with that, right, you can combine that with our HL span, which is one of the signature product, together with the our uplift. We have a product called uplift, and together with purify. So the combination of the 4 products. Number one is C-wise omega-3. Number 2 is a HL span, which could regulate all kind of problems. Number 3, because it also regulate anti-aging also. And number 3 is the purify. And number 4 is the uplift, to regulate your hormone imbalancing. So these 4 products can function very well for a person with Parkinson's. Either we try to freeze, let's say a person is experiencing like a tremor, mild tremor, and Parkinson's symptoms in the early stage, this works fantastically. And maybe like a stage 2 or stage 3, please try to have these products regularly, so that we try to reverse your aging process by reversal, and thereby your Parkinson got a very high chance to get slowly. I'm not going to say that we are going to do the magic here. I need to tell the truth. You can try, and there is a high chances that the Parkinson's can be reverted slowly, because remember, people get Parkinson's not suddenly. Parkinson disease is a process which a person got it almost like how experiencing of 30 years, 40 years, then suddenly you experience a mild tremor. You know, when you walk, right, you feel one finger only tremor like that. And slowly the tremor become multiple, tremor like that. And later on, stage 2, when you walk, right, you walk very slowly, and then you tremor a bit more. And then stage 3, you tend to forget things, like the muscle and brain coordination is being lost. And the motor functions, the movement will be lost. What we call your walking style, what we call it as a gait walking, G-A-I-T. Gait means the style you walk will be changed. And sometimes you'll be very quiet. So you will be a very cheerful person before that. And now you walk very quietly, You don't even talk to, you don't even say hello to a good friend. You don't even wave hand like that. You just be like that, keep walking. So these are different stages you are going to experience. But from stage 4 and 5, my dear friends, when you experience Parkinson, right, you are going to be bedridden. And stage 5, completely bedridden, wheelchair bound, and even somebody has to help you on your ADL. ADL means your activities of daily living, like waking up, stand up, and go to a washroom, shower, changing the clothes, having a coffee, every small thing. This is what we call ADL. Imagine you need somebody to help you. And imagine, who is that somebody? He can be a domestic helper. It can be your daughter or son or daughter-in-law, but they will be working professionals. That is where I'm telling you the health economics also very important. So we have a solution here, even to revert your Parkinson's in a slow manner, and then you can go ahead with that. And thanks for asking. This is a fantastic question.
Thank you, Dr. Dhamo. Okay, well, it's already 10:30. I'll maybe try 1 or 2 more questions, and then we'll end for today. There's a question about burping. What's the best kind of medical test for the burping loudly burping person should have? Because this person seems to she knows somebody previously with very bad burping, and then later got stomach cancer. So she's worried that the friend, also this one with the loud burping, will have stomach cancer.
Okay. So this is mostly due to the changes in the enzyme levels in the gastric system, like amylase, gastrin, pepsin, and papain, and all that. So now that's why I'm telling you, slowly we try to revert back your stomach health. And the best solution is probably the bloating and then the bad smell and everything, right? All because of the bacterial contamination in the stomach. So you are actually having, please remember, my dear friends, every stomach of you, right, you are having about 1 to 1.25 grams of the bacteria are present in your stomach. They call microbiome. So if the microbiome is very good, you are a very good person. If the microbiome is very bad, you are an unhealthy person. I don't say you are a bad person. You are an unhealthy person. So we need to really reverse back. We need to really eliminate the harmful bacteria to avoid all these symptoms what you explained just now. So the main solution for you here is we have the Purify, which contains lactobacillus, bifidobacterium, 5 different bacteria, to remove all your what you call unhealthy bacteria or harmful bacteria, and we need to re-establish a new microbiome in the stomach that can give you a solution for all the problems you mentioned just now. So you have one product, probably you can combine that with the HL span as well to support your other health issues, and then it can become completely reverted. So the two products like HL span and the Purify can really help to avoid all the problems you mentioned just now. Thank you.
Thank you so much, Dr. Dhamo. Okay, two more. Kenneth says, I'm still having post-COVID symptoms such as insomnia, tinnitus, intolerance to cold, no hunger trigger, no appetite, muscle weakness, and pain in bones. What can he do?
Okay, so this could be due to fluctuations in different types of vitamins again, because the infection, right, might have killed or might have arrested the vitamin metabolism, like vitamin C, especially vitamin B12 and vitamin K, vitamin E, and more especially the thienocolamine, the vitamin B complex. So you need to really revert them back, number one. How do you revert them back? So you need to have some kind of a supplements. So I don't want to recommend any kind of pharmaceutical and other things. So to avoid all these symptoms you're experiencing now, we need to really make you to slowly revert back to a housekeeping experience. Housekeeping means housekeeping inside your body. So the main housekeeping can be achieved by having a proper vitamin C complex. Vitamin C complex is considered as one of the major housekeeping vitamin, number one. And vitamin D is a major housekeeping vitamin for your all kind of health issues and osteoporosis and any kind of infection issues. So a combination of this with the vitamin B12 and thienocolamine can really help. So we have solution here with the H-stasis, which contains both. It's like a combination of both vitamins, multivitamins and multi-minerals, and that can combine with HL span. So H-stasis and HL span can be a good solution. And in case you experience any kind of a bloating issues and other things, you can also include the Purify to avoid all these post-COVID problems now. Yeah, thanks.
Okay, thank you. I think just one last, okay, actually got quite a lot of questions. Okay, two more. Okay, Dr. Dhamo, how much time do we have? I got two more questions. Is it okay?
Yeah, sure.
Okay, I think somebody, any solution for type 2 diabetes?
Yeah. So type 2 diabetes, again, we need to understand the level of type 2 diabetes and how chronic it is. That means how long it is. So if it is a bit longer period, right, it's better to revert back. So probably you might be taking now metformin, and they might have given you Januvia, they might have given you Diovan, Codiovan, and many drugs now, because if you are experiencing the diabetes for more than 2 years, right? So this is the regimen or the treatment regimen normally doctors prescribe. So I'm not anything against this medical recommendations, but then you want to go through the natural process, right? So you need to really regulate your insulin levels and regulate your sugar levels. So the solution here we have is the number one is you must regularly do the HbA1c test by every 3 months. That one test will really help you. And with that, right, you can have the number one is the HL span, number two is the Purify, number three is the H-stasis. So these three products will really help you to regularize your the sugar levels from the high glycemic index to low glycemic index. And meanwhile, I suggest you to watch your diet also, like lifestyle, go for regular exercise. So it's not only the products can do a magic, the product can do magic only when you have the willpower, like our Iris, she has successfully maintained the intermittent fasting, and she has conquered her thyroid cancer issues and all that. So you need to have the willpower, and then you need to apply the willpower to your regular exercise and other things. Then you can revert back. There's a possibility.
Thank you so much, Dr. Dhamo. Okay, with that, we come to the end of this session, but I want to tell you guys all about some upcoming events. Thank you so much, Dr. Dhamo. Today's session was really power-packed and really enriching. Okay, so please feel free to talk to the person who invited you tonight. Okay, they have more solutions. They will be able to give you, recommendations and tell you what to do next. And also talk to the person who invited you, so that if they want to, talk to our health consultants or talk to Dr. Dhamo even, okay, they can go through the person who invited you tonight. All right. So Dr. Dhamo is seeing people on Saturday, 10 a.m. to 2 p.m., but you got to be quick because it gets snapped up very fast. So, okay. And so with that, I want to also invite you guys and let you know about 2 live events in the office coming up. One is this coming Wednesday evening from 7:30. Can you hear me? Thanks. Okay. This coming Wednesday, there is Miss Singapore Universe 2009. Okay, her name is Miss Shah, and she will be sharing about how you can the universe of health and wealth. Sorry, can somebody unmute your phone? Mute your thing. It's really noisy. Can you help me to? Thank you. Okay, so this coming Wednesday, if you can come to the DWA's office, there is this talk. Okay, you can meet Mrs. Universe. Okay, and then also, I will also be doing a talk this coming Saturday, also in the office. If you would like to come and see me, and I'll be talking about transforming health and wealth on this coming Saturday in the DWA's office, 3 to 4:30. Okay, if you'd like to come, please also get back to the person who invited you. All right, and Thursday we have another Zoom event talk by Dr. Dhamo. Let me just give the title of that talk so that you guys all know what is it.
It's more on the gastric ulcer, gastric cancer, and gastrointestinal problems.
Yes, a lot of people are having all these issues nowadays because of diet, poor diet. Sometimes
I'll be talking about how the simple ulcer can lead to chronic ulcer, and how the simple ulcer can become gastric ulcer, and from there how it becomes gastric cancer, and how do you prevent it? How do you diagnose it? How do you prevent it?
Okay, guys, I was looking at one of the most expert in this area in Singapore. Dr. Dhamo is here. Okay, and did so much.
I have been doing research on these ulcer types and gastric cancers for almost more than 2 decades. So we have a lot of research experience on this topic. It's like a real hands-on topic which we have been working on it.
Yes. So thanks, Iris. Thank you so much. Okay, guys, we are coming to 10:40. Thank you so much for joining us this evening, and I hope that we answered your questions, and encourage you to just find out all these ways of biomarkers. You can basically do them at the Path Lab. These are some of the places, right, Dr. Dhamo, that we can. Of course, you can ask from your doctor. If your doctor doesn't want to do it, you can look for Path Lab and all these. Okay, but best is if you want, you can arrange a one-on-one consult with Dr. Dhamo this coming Saturday from 10 a.m. to 2 p.m. Okay, this is a free consultation for our members. All right. So thank you so much, everybody. Thanks for coming, and I wish you all the best, and hope to see you guys at the next event. Thank you.